Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking with Rudy Jackson, who is the Senior Vice President and Chief Nurse Executive at UW Health, about span of control for nurse managers. So, hi, Rudy, how are you?
Great, G. Thank you so much for having me.
Yeah, of course. Thanks for taking the time. So let's jump right in. Can you walk me through the findings of the Quantifying Nurse Manager Impact Study?
Yeah, so it's interesting. We conducted the original study that was put on by the Ontario group probably 2 years ago, and we're very
Mhm.
fortunate that we were able to do that because we were able to then take that data and then compare it to the most recent data that was completed from the academy. And what we learned out of this work was like, nothing surprising. Our nurse managers are spread pretty thin.
Mhm.
And when you look at other groups within the organization, other areas, and you look at their span of control, it's very, very different. So when I take the span of control of the Department for Environmental Services, their managers have a lower span of control than the managers within nursing. Same for
Mhm.
all of the other departments in our organization. And yet we put so much incredible pressure on our nurse managers to manage finances, manage culture, manage patient experience, manage quality, keep your
Mhm.
turnover rates down, keep your length of stay down. All of these things that we put on their plate, and yet we have all of these things that we put on their shoulders before they're able to get those things done. So I think the most recent study that was completed was really pretty profound for us, and we've started to invest a significant amount of energy around what are those things that we need to do to help reduce that span of control for our leaders. Some of the metrics as simple as things like total number of headcount versus how many pilots they're doing. What is the
Mhm.
diversity of the workforce? All of those different metrics. And so, within the span of control of nursing, what can we do to help alleviate and reduce some of that burden from our nurse managers? And so, the most recent study that was conducted allowed us to really take a look at individualizing that study for our team and our workforce, and then taking into
Mhm.
account some of the things that we can control that we can eliminate off of their plate.
Absolutely. So, from a CNE perspective, what do you think has to change within a health system to reduce the span of control for nurse managers?
Well, that's a great question, and it's a little bit difficult to simplify into one or two different things because one
Mhm.
would argue that giving them additional support, i.e., in the form of assistant managers, would be greatly beneficial to them, and that may be true in some cases, but not necessarily
Mhm.
at all. When you look at the
Mhm.
span of control data for an organization like UW Health and you compare us to others, we do have a lot of resources that support our managers, and yet their scores were really high. And so, as a
Mhm.
CE, it's a matter of trying to understand what exactly are those individual things that are impacting our leaders, and how can I leverage technology to offset some of that burden. So one of the things that we're doing, and I'm actually going to be presenting this to the Nurse Manager Council. We developed a Nurse Manager Council here at UW so that our nurse managers had a venue so that they could voice
Mhm.
innovative solutions, questions, problems, concerns that they have. We also utilize that for their part of their professional development, and we give them some education. But I am going to be presenting to them very soon not only the findings of the span of control, but really what we're going to do next. What we're going to be doing next is going to be conducting some time studies over several weeks with managers across our enterprise to really see and
Mhm.
develop that Pareto chart of things that they are spending their time on. One of the solutions I heard recently from a CNE was, well, we give our managers a day off once a week, and I think on paper, in theory, that would work pretty well. The reality is
Mhm.
though, that the work doesn't stop, and so I used myself as an example. I go on vacation, I come back, and I've got 800 emails that I need to go through. I've just compounded the amount of work I need to do the next day, and so I think that
Mhm.
also is true with a lot of our managers. And so, as a CNE, we need to start thinking about innovative solutions, leveraging technology, offering the appropriate support, but do so in a manner that doesn't add additional cost to organizations that already exist on razor thin margins. And so that's really what we're looking at here at UW to really help support those individuals.
Absolutely. So, you mentioned turnover rates. So, how does lowering the span of control for nurse managers impact turnover?
Well, when you look at leadership, right,
Mhm.
there's a whole science around leadership. There is, transformational leadership. There is servant leadership. We've all heard all of the buzzwords around
Mhm.
leadership. What I tell the team is those are all important. They're important for us to understand. But the reality for me is that leadership is really just simple. It's about relationships. It's about the
Mhm.
human connection. It's about an individual being able to take care of another person. As nurses, I tell folks that, you know, when I get asked, do I miss emergency medicine? Do I miss trauma? Do I miss the bedside care? What I say to them is I still provide the same level of care I did as a bedside nurse, as a clinical nurse, in my current role. The difference is that my patients are now vertical; they're no longer horizontal. And I think a lot of
Mhm.
our managers feel the same way. So they are very, very, very engaged and supportive of their teams. I think reducing the span of control is going to allow them to do what they really want to do, which is take care of the
Mhm.
people that are taking care of our patients. And if we can do that, then things would be different in all of our environments, in all of our departments. It's as simple as the Southwest airline model or the Chick-fil-A model, right? If we take care of the people that are taking care of our patients, then our nurses will take care of our patients. So that reducing the span of control, getting these managers out of their office, eliminating the number of audits that they need to complete, or the pilots that we have them doing, or the check boxes that they're needed to go through for everybody's evaluation and everybody else's competencies, all of those things, that's busy work. That's management.
Mhm.
What I need are leaders. And reducing that span of control for those managers is going to allow us to move those individuals into a leadership role where they're truly able to guide their teams, develop those relationships, reduce turnover, support their vacancy rates, improve quality outcomes, improve the patient experience, and ultimately reduce costs.
Yeah, absolutely. It kind of sounds like a no-brainer when you put it like that. Um, yeah, but so what is the ideal role that an assistant nurse manager would play in this equation?
So there's a couple of different models that I've looked at that I've worked in. I've worked in environments where we've had assistant managers. I've worked in environments where you don't have assistant managers. We are actually in the process of trying something new. If I had gone to the
Mhm.
finance team and said, I need to hire 42 assistant managers to reduce the direct reports of our workforce by 30%, that's going to be a tough sell for me.
Yeah.
Again, you've got organizations with razor thin margins. How am I going to offset an additional 30, 40 FTEs with
Mhm.
benefits and all of that expense that's tied? So what we've challenged our team with is start looking within. What resources do we have internally that can allow us to start to decrease that administrative burden of those managers so that we can get them out of their office and elevate the roles of some of the others. We're very fortunate at UW. We have full-time charge nurses. We call them CTLs, care team leaders. And so right
Mhm.
now we're actually working with a group of CTLs that are looking at how do they elevate their role to be part of that leadership team to offload some of that administrative burden so that the patients or the nurses can be then supported by the manager in a different manner. We're looking at
Mhm.
technology to remove the burden of scheduling. How do we move towards uh, self-scheduling models and self-scheduling platforms? How do we support our managers with more technology that allows them to offload again some of that manual work that they've been doing? I also think we
Mhm.
need to challenge our IT departments around the country. I give this example quite often, but in 1990, the very first dictation system was created to support physicians when they were dictating their notes.
Oh,
34
wow.
years later, 34 years later, we're just now talking about how do we do that for nursing? We've got
Mhm.
to be able to put pressure on our IT departments to find those solutions that help nurses and help ultimately the organization make our leaders more efficient, support our nurses even better. So I think the role of the assistant nurse manager is valuable.
Mhm.
If there's a system that doesn't have the ability to start creating that role, then it's going to be important that we start to create additional roles that could
Mhm.
be, or I'm sorry, not create additional roles, but utilize existing roles to be more supportive of the manager. Things that I've done in the past with assistant managers has been things like offloading, scheduling, and evaluations. In a previous life, I had I had an assistant manager that I worked with that we used to joke that the individual was the bad cop and I was the good cop. I would go out and round and build the relationship and do the things that I wanted to do as a leader. But when there was trouble that needed to be handled, it was something that the assistant manager would navigate
Mhm.
and could facilitate. So I think there's a lot of different ways to utilize the assistant manager role, but I don't think that we need to be stuck with the solution that the assistant manager is the only way we're going to fix the manager span of control. There are other solutions that we need to be thinking about as well.
Absolutely. Do you think something like virtual nursing would help kind of offload that work?
Some of it, I think when I think of virtual nursing, I think a lot of the traditional stuff, and this is a really interesting topic to bring up because, we're on the virtual nursing journey right now, and we are
Mhm.
looking at it currently as a mechanism to support our direct care nurses in multiple different capacities. But what
Mhm.
else can we leverage the technology to do? And that's what I challenged the team with doing. One of the things that we're going to be trialing at our children's hospital is a virtual mentorship model where
Mm.
if I've got a relatively novice workforce on a night shift in any one of our units, is it possible for me to have a more seasoned and experienced nurse working virtually that can round on all of the patients, connect with all of the nurses individually, and just give them some input and say, hey, have you considered this, or have you thought about checking on this lab value or checking on this situation? Also, giving those nurses an ability to connect with that nurse to ask those questions when things like that come up. I think the virtual
Mhm.
nursing platform opens up a wide array of opportunities that we haven't even begun to touch on just yet. And I think currently the virtual nursing platform is something that we are building midair. Some
Mhm.
organizations are doing it really well. Some of us are just getting into it. But it's really about how do we expand and leverage that technology to do things that were outside of what it was originally designed to do. Virtual nursing was originally designed to do admissions and discharges. But what else
Mhm.
can that model do where we can again support our nurses, support our leaders, and ultimately improve our patient outcomes?
Absolutely. So, we've talked a lot about cost throughout all of this. So, how do you think that CNOs or CNEs can make the ROI case to switch, the care model to either lessen span of control or kind of implement something else to help with that?
That's actually the really easy one, right? Because
Hmm.
although you wouldn't typically hear that, this one's really easy because if we can do the things that we know are going to bring value to the system, the only thing we
Hmm.
need to do is identify what metrics it is we want to measure. Look, if I
Hmm.
wanted to bring in a nurse leader to reduce the turnover rate on a unit that has a 30% turnover rate, and this individual goes in, develops those relationships, and suddenly that turnover rate on this unit is now 4%. Well, we've already got an ROI on this role. We've already
Absolutely.
identified what the return of investment is here, particularly when
Hmm.
bringing in a new nurse could be anywhere from thirty to $60,000, depending on what you're looking at. Right? You compound that with the number of vacant positions you have, and you've identified your ROI. That's just one
Hmm.
metric that we could look at. We can also look at quality outcomes, fall rates. If we start using things like the virtual platform to reduce falls or improve quality outcomes, again, there's an ROI tied to that. If I can eliminate some of that burden on our direct care nurses, then those nurses are going to get those patients discharged earlier, which then reduces
Hmm.
length of stay, which also has an ROI. I think with this particular question, we are very, very, very data rich within nursing. We just need to identify what metric we want to tackle and assign
Hmm.
work with our finance teams to identify that dollar amount. It's there
Hmm.
without question. It's there. We just need to use it and then bring it forward so that we can identify the ROI.
Absolutely. Well, thank you so much, Rudy, for your time. I'm grateful to have had this opportunity to hear your insights, and thank you so much to our audience for listening.
Yeah, thanks so much, G. I appreciate the opportunity. Look forward to connecting with you again in the future.
Of course. Thank you.